An herbalist, one who studies the constituents of a plant, being the leaves, flowers, roots, barks, and seeds, and also extraction of those particular constituents through a biochemistry mechanism, allowing them to extract the medicinal properties in preparation for natural healing. Here in the Western Hemisphere, being the United States of America, many individuals who are starting to practice the art of herbalism, becoming herbalists, being more involved in natural healing. But in the United States of America, there is no certification, no license, no recognition of being an herbalist, such as a medical physician, a licensed acupuncturist, a licensed masseuse, a licensed chiropractor. So one who is practicing herbalism as an herbalist is most likely practicing at their own risk, which leads to them having to take the initiative to take the proper steps in becoming a proficient and safe herbalist, starting off by studying and taking classes, courses, educating themselves on the art of herbalism and the safeness, the precautions. Speaking of precautionary, I'm going to lay out 10 objectives in no particular order, no particular level, that one who is practicing herbalism as an herbalist in the United States of America should be mindful of and have these things perfected before they start to claim to be an herbalist and furthermore practice it. In China, Japan, India, what have you, but there are certain herbs that are very toxic that are forbidding to being purchased in the United States of America. So you must understand that herbs and its active constituents, level of degree of how powerful that herb is. When you're doing your formulas, I know in Western herbalism, most times they use between 2 to 4 herbs within their formula. Okay, is the secondary herb, do I have too much in it that will overpower the primary herb, or do I have too much of the tertiary herb that will not give enough potency from the secondary herb? So all of this matters, knowing the degree of potency of the herb, and that's going back to our treatment category dealing with dosage. Everything has to be balanced. So you must be mindful of the particular herb that you can use, because as we stated before, just as herbs can heal you. Number 10, drug interaction contradictions. As an herbalist, you must be mindful of what herbs you're recommending or prescribing to a particular inquiring mind or client, because certain herbs can be contradicting to a particular medication or drug that your client may be on from their primary physician. So we must be mindful when we recommend these things. Now, in the herbalist world, we don't like to treat something with a singular herb. We like to use formulas. But there are times where inquiring minds may ask, I have this particular thing going on. What herbs do you have? So we go to recommending, well, you should take this for that, which is fine if you stay on the mild sense. But this is why a proper intake, getting the proper clinical history from your client, especially if they're under the care of a primary physician currently, that we must have this information before we recommend or start to treat someone with herbs. Because some herbs can contradict or cause that particular drug that they're on or medication to not work. Now, as we stated earlier, we are not licensed in the United States of America. We're practicing at our own risk, which is why in our consultation process, herbalists should always have your client sign a waiver form saying that you're doing this only off my recommendations. Okay, so in saying that, a person that is on some type of medication or drug from their primary physician supersedes our treatment of a particular herb. Now, if the client wants to take that herb, that's at their own risk, from which they signed that waiver form. But if it's just an inquiring mind coming into your store or in the grocery store on your way or at a house party and they're asking you these things, you must be careful, because recommending certain herbs can have a contradiction to their drugs and medication that they're currently on. And I'll give you an example. We have a 65-year-old female who has, in medical term, hypertension, HTN, also known as high blood pressure. And she also has arthritic pain. Her right knee hurts, and she had a left hip replacement. And her doctor, her physician, has her on a blood pressure medication. Something like amlodipine, or the generic name Norvasc. Taking whatever the prescription she's taking to lower her blood pressure. So she comes to an herbalist and inquires, what herbs are good for lowering my blood pressure? And we can quickly name out a particular herb or two. But without knowing that she's on Norvasc or amlodipine, which is a medication prescribed by her primary physician, her cardiologist, to lower her blood pressure, we're going to give her an herb like, for example, ginkgo biloba, which also lowers the blood pressure. So now she's taking her primary medication, Norvasc, to lower her blood pressure, and we're prescribing her with ginkgo that also lowers her blood pressure. So now you're at the risk of causing more harm, because now you may have this client lower her blood pressure more so than it should be. Now she goes sees her physician, and her physician can't figure out why this dosage is not working. So he's going to make adjustments to his dosage, but making those adjustments may cause more harm, because he's not aware that he or she, well, this particular female, is taking this herbal treatment that is actually lowering her blood pressure too. Maybe because she failed to tell the physician that she's on a herbal treatment. When you do your consultation, you should make sure they notify and get permission from their physician if it's okay if they go on an herbal treatment. So, in saying all of that, we must be mindful of the drug interaction contradictions. Their primary care from their primary physician, their medical care, supersedes our herbal treatments. So you do not want to be giving or recommending herbs to certain people that may be on some type of medication or drugs that can cause more bodily harm to that client or that inquiring mind, causing more havoc and confusion with the licensed physician who is under a license where they can get their license revoked or even sued through malpractice insurance. So we want to work with physicians. We want to work with chiropractors. We want to work with fitness trainers. We want to work with pharmacists. We want to work with these people to bring natural healing more into the light, and also make a relationship with the herbalist, their primary care, and the client to have them as healthy as possible. So as an herbalist, you should be mindful of the herbs that you recommend and the herbs that you treat, because there's a possibility that it can cause a contradiction, just as that herb can cause complications for the purpose of that drug. The drug can also cause contradictions for the herb. So now you, as the herbalist, wondering why this herb is not working, while this dosage, and you're adjusting your dosage. Now you may be giving them too much because you're thinking it's not working, but in actuality it's the drug that's overpowering the herb, or the herb is overpowering the drug. So you do not want to play down that route. Do the proper consultation, get the proper clinical history, and treat your patient and treat your client adequately, and treat your client responsibly. It is not our job to guarantee life, rather provide a healthy life. T-Cell.